Good evening, all. I am Vali Prabhakar. Thank you, Father, and all admin members for this opportunity. This week we are discussing reading part B.
Yeah, thank you, Valli, and thank you all admin panel and Father for giving me this opportunity. So here they are talking about the manual. So I told you manual is a handbook. We can say, or we can say a book giving instruction or information. When we buy something, they will give a set of
എടാ നീ ഇവിടെ
instructions.
ഇല്ലല്ലോ എന്താ വെച്ചേക്കുന്ന
So this paragraph is fully about a blood pressure monitor and how it works. So first option is likely to interfere with operation of other medical equipment. So other medical equipment we no need to know about it, because here they are not asking about any other medical equipment. So logically this cannot be right. Okay, and when you see the last option should be considered safe to use in all hospital environments. So all is what here?
Absolute.
All is an absolute. So according to the strategy, we are directly eliminating this option. So what is remaining for us? Only B option. So let us, is the answer we know, but still we need to read the paragraph. So here we have to always focus on topic sentence to understand the gist or the main idea of the paragraph. Instruction manual. So they are telling it is a manual. About what? About digital automatic blood pressure monitor. So what is the heading here? Electromagnetic compatibility. This is the heading. And topic sentences: with the increased use of portable electronic device, medical equipment may be susceptible to electromagnetic interference. So this is what, so this is a topic sentence. So is it a cause or a effect? It is a effect. So this may result. Which may result? So result is an effect here. They're talking about effect. So there is a problem here and there is a solution. Okay. So let's see what is the problem here. The problem is this is in order to regulate the requirements of his the main preventing unsafe product situation. This standard defines the levels of immunity to electromagnetic interference as well as maximum level of electromagnetic emissions for medical devices. This medical device conforms to EN 60601 2001 for both immunity and emissions. Nevertheless, what is nevertheless here? Contrast word, right? So care should be taken. So they are telling a solution here. What is the solution? Care should be taken to avoid the use of the monitor within the 7 meter of cell phones. So what is they talking about? They're talking about the blood pressure monitor and not the cell phones. Okay, our main hero is what? Blood pressure monitor. So they are telling us, if this comes in contact with 7 meters of cell phones or other devices generating strong electrical or electromagnetic fields, this may interference the work of blood pressure monitor. This is the thing. So it is beautifully explained by Father in the next slide, like describing which is the cause and which is the solution and which is compatibility and caution. If you can see here, what is the effect? Yellow color. Incorrect operation of medical device and create a potentially unsafe solution is an effect, okay, or a result. So cause is what? Electromagnetic interference. Where is the solution? You can see the next line: solution. Solution standard defines the levels of immunity to electromagnetic interference. And if you see, this is the compatibility. This medical device conforms to for both immunity and emissions. And what is the caution? Nevertheless, care should be taken to avoid the use of the monitor within the 7 meters of cell phone or other devices. So this is the caution. And this is telling us that our answer is answer B. So next, if you see the slide, there is explained about the paragraph structure. Here, this question, there is a problem. then there is a cause, then there is the effect, then solution, and compatibility. Relation between the each problem, cause, effect, solution, and compatibility. So what is the problem here? We said that blood pressure monitor is electromagnetic interference. This is the problem. What is the cause? Electromagnetic interference. And what is the effect? Incorrect operation of the medical device and create a potentially unsafe situation is the effect. And they have given a solution as well. What is the solution? The standard defines the level of immunity to electromagnetic interference as well as maximum level of electromagnetic emission for medical devices. This is the solution. What is the compatibility? This medical device conforms to EN 60601 to 2001 for both immunity and emission. What is the caution? Care should be taken to avoid the use of the monitor within 7 meter of cell phones or other devices. So this is a paraphrasing of the last sentence. See, you can see the answer is nevertheless care should be taken to avoid the use of the monitor within the 7 meter of cell phone and other devices generating strong electrical interference. So that is the paraphrasing of answer B. May not work correctly in close proximity to some other devices. So this is our answer. I hope I'm. So second one is what? The notice is giving information about. So this is a notice. They have given a notice and they are giving the information about what they are asking. So they are asking a about question here. So let's see what they're asking about. First is ways of checking that an NG tube has been placed correctly. Then how the use of NG tube is authorized. So we have all the answer as last one. Let's check. If we know the paragraph structure, we know that the answer will be always at the, in this question, the answer will be at the second half of the paragraph, because the first one is telling the NG tube feeding tubes. This is the heading. And the first sentence says that displacement of NG tube feeding feeding tubes can have serious implication if undetected. So if they are not detected, there can be some serious implications. So half of the paragraph will be speaking about the what they're speaking about, serious implications, right? So half the paragraph is always, if you know the topic sentence, that it is speaking about the serious implications. So incorrectly positioned tubes leave patients vulnerable to risk of the regurgitation and respiratory aspiration. So this is everything is talking about topic sentence. What is the topic sentence? Serious implications of nasogastric tube. So it is crucial to differentiate between gastric and respiratory placement on initial insertion to prevent potentially fatal pulmonary complications. So till here, everything is about what is that? Serious implication. So this is all about the topic sentence, that is serious implication of nasogastric tube. But in the answer option over, they're talking about anything called serious implications, right? So this half of the paragraph is we can neglect it because it is all about serious implication risk of NG tube feeding. Okay. Now comes the second half. What is the second half? Insertion and care of nasogastric tube should therefore only be carried out by a registered doctor or a nurse who has undergone theoretical or practical training and is deemed competent or is supervised by someone competent. This is a paragraph paraphrasing of which answer option? Can anyone tell me?
C. Option C.
Yeah, C. Yeah, which staff should perform NG tube placement? So this whole thing is talking about who has to do the NG tube placement, isn't it? So in the last line also says the same thing, but in opposite way. Assistant practitioners and other unregistered staff must never insert NG tubes or be involved in the initial confirmation. So this says what? That only the registered or a nurse who has undergone the training can do this task, but not the assistant practitioners or unregistered staff. I hope I am clear to you.
Question number 3. What must all staff involved in the transfusion process do? Here hedging word is must all staff and transfusion process do. Then answer option, check that their existing training is still valid. Option B, attend a course to learn about new procedure. Then option C, read a document that explain changes in policy. Now we can see the text. Heading, right patient, right blood assessments. The administration of blood can have significant morbidity and mortality. Following the introduction of the right patient, right blood safety policy, all staff involved in the transfusion process must be competency assessed. To ensure the safe administration of blood components to the intended patient, all staff must be aware of their responsibility in line with professional standards. Staff must ensure that if they take any part in the transfusion process, their competency assessment is updated every 3 years. All staff are responsible for ensuring that they attend the mandatory training identified for their roles. Relevant training courses are clearly identified in Appendix 1 of the mandatory training matrix. Here, the keyword is must all staff. In option A, we can see check that their existing training is still valid. Here, that in the whole para, they are mentioning all staff what they have to do during the transfusion process. Only they are telling. The third line, all staff involved in the transfusion process must be competency assessed. In question also, the must word is there. Here also, must is coming. Must be competency assessed. Then second, all staff must be aware of their responsibility. Then again, staff must ensure that if they take any part in the transfusion process, their competency assessment is updated every 3 years. The option A also telling about them, check that their existing training is still valid. That updated means that is valid or not, like that they have to check. The whole para is telling about during the who are all attending the transfusion process what they have to do. They must be competency assessed, they must aware of the responsibility, and they have to check the validity, their existing training is valid or not. It is telling about the training valid only. So answer option A is correct answer. Then second option, attend a course to learn about new procedure. In this para they didn't mention about any new procedure, so we can eliminate the option B. Then option C, read a document that explain changes in policy. In that paragraph they didn't mention in the changes in policy, so we can eliminate option C. So answer is option A is correct answer. Fourth question, the guidelines establish that the healthcare professional should. Here we have to see what healthcare professional have to do something. So in option A, aim to make patient fully aware of the right to a chaperone. Option B, evaluate the need for a chaperone on a case by case basis. Option C, respect the wishes of the patient above all else. Paragraph, extract from chaperone's guidelines for good practice. A patient may specifically request a chaperone or in a certain circumstances may nominate one, but it will not always be the case that a chaperone is required. It is often a question of using professional judgment to assess an individual situation. If a chaperone is offered and declined, This must be clearly documented in the patient's record, along with any relevant discussion. The chaperone should only be present for the physical examination and should be in a position to see what the healthcare professional undertaking the examination or investigation is doing. The healthcare professional should wait until the chaperone has left the room or cubicle before discussion takes place on any aspects of the patient care, unless the patient specifically requests the chaperone to remain. Now we can see the option A. Aim to make patient fully aware of their right to a chaperone. They didn't mention the option A in the paragraph. Then option B, evaluate the need for a chaperone on a case by case basis. That topic sentence after the contrast word, but it will not always be the case that the chaperone is required. In the topic sentence telling patient may request the chaperone in some circumstances, but it is not mandatory. But the health professional should analyze they need a chaperone or not, they have to decide. But it will not always be the case that the chaperone is required. It is often, this is the time expression, it is often a question of using professional judgment to assess an individual situation. In the option B, it is telling case by case basis. This is paraphrased here. Individual situation is synonymous of case by case basis. The healthcare professional should evaluate that patient need chaperone or not. So the healthcare professional should evaluate that one. So option B is the correct answer. Then option C, repeat the wishes of the patient above all. This option also didn't mention in the paragraph. So correct answer is B. I hope you all understood.
Question number 5. The guidelines require those undertaking a clinical medication review too. This is a guideline. Require those undertaking a clinical medication review. First, we have to identify the hedging word. What are the hedging words in the question stem? The guidelines. They will tell you about the what is the uh, question patterns, the guideline. It is asking about the undertaking a clinical medication review too. Then next we have to read the answers. A QAT method we have to follow. So next we have to see the answer option. Answer option A, involve the patient in their decision. Here we have to underline the hedging words. What are the hedging words? Let us involve the patient in their decision is a hedging word. And then option B. Option B is consider the cost of any change in treatments. Here, what are the hedging words? The cost of any change and in the treatments. And option C is recommend other services as an alternative to medication. Here, recommend to other services and alternative to medication. So, these are the hedging words. After that, we have to read the text. Annual medication review to give all patients an annual medication review in an ideal to strive for. In the meantime, there is an argument for targeting all clinical medication reviews to those patients likely to benefit most. Our guidelines state that at least a level 2 medication review will occur. The minimum standard is a treatment review of medicines with the full notes but not necessarily with the patient present. However, the guidelines go on to say that all patients should have the chance to raise questions and highlight problems about the medicines and that any changes resulting from the review are agreed with the patient. Here, as per father's strategy, see the topic sentence, we have to understand that what is the gist of the paragraph. Here they are asking about the clinical medication review. After that, there is a contrast word. See, after that, definitely answer will be there. So we can stop reading this because that by with this we can defeat the enemy with time. So here we are using the contrast word However, we can identify the answer. Here, the answer option A involve the patient in their decision. That is paraphrased in this text. However, the guidelines go on to say all patients should have the chance to raise questions and highlight the problems about their medicines and they that any changes resulting from the review. So this is paraphrase. That what is the text is telling that we have to involve the patient. They have a right to raise questions about the medication review. So it's paraphrased in this text. And this is the right answer. Option B, why we have eliminated means consider the cost of any changes in treatments. Here they are not they are telling the treatment review, but it's not. But minimum standard they are telling, so we can eliminate the cost in there is not mention about the any change in the treatment. So we can eliminate that option. And the option C is recommend other services and as an alternative to medication. Here they have not mentioned about the alternative medication. So that also we can eliminate. So answer is involve the patient in their decision. Answer is option A. We'll go to the next question. Question number 6. Here the question is the purpose of this email is to. This is the email. So we have to underline that is the purpose of the email. Then we have to read the answer option. Answer option A report on a rise in post surgical complication. Here the edging word is rise and then option B is explain the background to change in patient care. Here, the change in patient care. That is the hedging words. And option C is remind all staffs about procedure for administrating drugs. Here, what is the hedging words? Is a procedure. So, next we'll go to the text. In August, an alert was issued on the safe use of opioids in hospitals. This reported the incidence of respiratory depression among post-surgical patients to an average 0.5%. Thus, for every 5,000 surgical patients, 25 will experience respiratory depression. Failure to recognize respiratory depression and institute timely intervention can lead to cardiopulmonary arrest, resulting in brain injury or death. A retrospective multicenter study of 14,720 cardiopulmonary arrest cases showed that 44% were respiratory related and more than 35% assured on the general care floor. It is therefore recommend that the postoperative patients now have continuous monitoring instead of spot checks of both oxygenation and ventilation. Here in the text, they are mentioning about the uh, this post surgical complication. Here, may among post surgical patients to an average 0.5%. This is less than 1%. So it's not mentioned about the any rise in the post surgical complications. So option A is telling the report on a rise in post surgical complications. Here they not mention any rise. They just mention the 0.5%. So we can eliminate that option. The next option B is explain the background to a change in patient care. This is the answer. Why? Because here in the text there is a therefore they mentioned is a sequential expression. After that sequential expression they are mentioning about the recommend that postoperative patients now have continuous monitoring instead of spot checks of both oxygenation and ventilation. They are here they're telling that they are following the post operative patients have continuous monitoring but instead of what they regularly they are checking the spot checks and oxygenation and ventilation they usually check, but what they are recommended here they are recommending that continuous monitoring they are recommending. So let us paraphrase of that option B. Explain the background to a change in patient care. Here they are changing instead of spot checks. That is the paraphrasing of the part. So here what this is the answer option. Why we are eliminating option C is remind staff about procedure for administering drugs. Here if they mention anything about the administering of any drug, no. So we can eliminate that option. Thank you all.